I just couldn't go from here to there. I had no physical stamina. I had very little breath control. I was running out of breath when I was doing things. I couldn't go outside and cut the grass. I had to get my son to do all of the yard work for me. I would try to do something, and if I exerted myself, I'd almost have to have help to get back in the house.
The most common by far symptom that we hear from a patient before they go into the procedure is shortness of breath. And without a doubt, if your shortness of breath is related to aortic stenosis, after you have your valve fixed, your shortness of breath is going to be better. So the normal aortic valve has 3 leaflets. This is the way it should open. So what happens is, as you age, calcium builds up on the edges of the leaflets and they tend to fuse together in places. The leaflets will just open like this at the very tips, and there's much less opening when that happens. The number one thing that I would say to referring doctors is refer early. Aortic stenosis patients, it's like a plateau. You go along, go along, go along, go along, go along, and then all of a sudden you fall off the cliff. Okay, it's not a gradual and steady decrease. It's really, they go from here to here in an extremely short period of time. And so what happens is if you catch them here, you're great. If you catch them here, then the pumping function of their heart's extremely weak. They're extremely frail, they're short of breath all the time, and a lot of times they're too sick to have anything done at all.
There's a team of 6 doctors who are going to help you through this. They were professional in everything that they did. As soon as I met Dr. Glover, they explained the examinations they would put me through, the tests they would run before they went to the procedure.
You will meet with us, you get to meet with your physician. We will describe and explain all these screening tests to you. The screening process itself lasts about 8 hours, but once that day is over, you only have the one time you have to come back to see us, and then we see you on valve implementation day. And so the process, we walk you through every step of that process, take care of all of those problems for you so that you can have all those fears eliminated and we can get you feeling better as quickly as possible.
They have lab work done to verify that they're not severely anemic, they don't have a urinary tract infection, that everything's going to be okay for the procedure itself. And then the following morning they come to the hospital, they come to the prep and recovery area, they have an IV placed, and then they'll be taken to our hybrid operating room. Once you're there, anesthesia is there. Anesthesia will be administering the sedation and monitoring the patient during the case. We use a needle to access the artery in the groin after we give some local anesthetic. And then we put in larger and larger tubes until we get to the size of tube that we need to put the valve through. We then put a wire up across the valve in the heart, slide the valve over the wire until it gets to the correct place, and then under fluoroscopy, we deploy the heart valve and pull the wire out. After the valve is deployed, we use a combination of echocardiography or ultrasound of the heart and angiography, which is just X-ray imaging, to verify that the valve is in the correct place and the valve is not severely leaking. Then we close the hole that we put in the patient's leg, normally by using a suture closure system that does not require surgery. That's successful about 90% of the time. But if for some reason it does not work, we have a vascular surgeon in the room that can make a small 2-inch incision and close the artery itself. And then the patient is woken up from their sedation and transferred to our post-anesthesia care unit.
Generally by the about 3rd hour post-procedure, they are awake, they're sitting up, they're talking to us, and then we always get information out to the family, let them know how they're doing. Family is reunited after the 6 hours, so the time that they leave their family member at the elevator with me till they get back to their family member is 6 hours.
These folks are really professional. They know what they're doing. It was all over before I knew what happened in a way. And I only spent one night in the hospital, went home the next day. Home nursing was available and furnished, along with physical therapy. And they got me back on my feet in a hurry. The only scars I had were the entry scars in the groin area, and they've closed up completely, healed up beautifully. I've got strength I didn't know I had, a little more stamina, and I'm getting more every day as things go along. Being with my wife and able to do my part in the jobs around the house means a lot to me. Kind of being able to regain my self-respect in a way. Boy, it was worth the whole thing. And the part of it is that there was nothing on my part. It was all done for me. It was just let them do the job, and you're going to be surprised how well you're going to feel and how much it's going to help. That was the good part. I didn't have to do anything, but just trust, and they are the people you can trust.